Hello everyone, so this is the second episode in the series of mood disorders videos. So what is a manic episode according to the DSM-5 criteria? So a manic episode is a distinct period of abnormally and persistently elevated, expansive or irritable mood and abnormally and persistently increased goal-directed activity or energy lasting at least 1 week, or any duration if hospitalization is necessary, and including at least 3 of the following and 4 if the mood is only irritable. So let's begin with the criteria. So number 1, distractibility. 2, inflated self-esteem or grandiosity. 3, increase in goal-directed activities such as socially at work or sexually or psychomotor agitation. 4, reduced need of sleep. 5, flight of ideas or racing thoughts. 6, more talkative than usual or pressured speech. 7, excessive involvement in pleasurable activities that have a high risk of negative consequences. For example, shopping sprees, sexual indiscretions, and symptoms are not attributable to the effects of a substance, drug or medication or another medical condition, and they must cause clinically significant distress or social occupational impairment. And one thing you need to take note of is greater than 50% of manic patients have psychotic symptoms. So the mnemonic to remember symptoms of mania is dig fast. So distractibility, insomnia, impulsive behavior, grandiosity, flight of ideas or racing thoughts, activity, increased activity or agitation, speech is pressured, and thoughtlessness. So let's talk about bipolar 1 disorder. So bipolar 1 disorder involves episodes of mania and of major depression. However, episodes of major depression are not required for the diagnosis. It's also known as manic depression. That's what it was previously known as. Okay, so you need to take note that if you just have one episode of mania and no episode of major depression, the diagnosis is still going to be bipolar 1 disorder. So diagnosis and DSM-5 criteria. The only requirement for this diagnosis is the occurrence of a manic episode, and 5% of patients experience only manic episodes. However, 95% do experience depressive episodes at some point in their life. Then between manic episodes, there may be interspersed euthymia, major depressive episodes or hypomanic episodes, but none of these are required for the diagnosis. So only a manic episode and then your diagnosis will be bipolar 1 disorder. Let's talk about a case presentation. So I'm presenting a S male 25 who presented due to violent behavior for 1 day. For a month, patient has also experienced elevated mood, increased energy, increased talking, and insomnia. Patient has 2 suicide attempts in the past and currently has no suicidal ideation. So let's just pause the video for a minute and try to see the positives here. So let's look at them. So there's violent behavior for 1 day. However, we said for you to put it as a manic episode or mania. As long as it requires hospitalization, it falls under the criteria of mania. So yeah, for a month, patient has also experienced elated mood, increased energy, increased talking, and insomnia. And patient has 2 suicide attempts in the past, which may kind of lead to the diagnosis that maybe the patient was depressed at some point in their life. So our diagnosis is bipolar mood disorder with current manic episode. So let's talk about the treatment. So treatment is from biopsychosocial approach, in which we're going to start with the bio, which is the pharmacological approach, then psycho, which will be the psychotherapy, and then the social approach. So pharmacotherapy, lithium is a mood stabilizer, and 50 to 70% treated with lithium show partial reduction of mania, and long-term use reduces suicide risk. Acute overdose can be fatal due to its low therapeutic index. Then other drugs that are also used are anticonvulsants, carbamazepine, and valproic acid. They're also mood stabilizers, and they're particularly useful for rapid cycling, bipolar disorder, and those with mixed features. Okay, and one thing you need to know about lithium is lithium has got a lot of side effects. So to mention a few, there's irritability, tremors, hypothyroidism, polydipsia, hair thinning or alopecia, muscle weakness, etc. Then we've got atypical antipsychotics can also be used, such as risperidone, olanzapine, quetiapine, ziprasidone. They're effective as both monotherapy and adjunct therapy for acute mania. In fact, many patients, especially with severe mania and or with psychotic features, are treated with a combination of a mood stabilizer and antipsychotic. Studies have shown a greater and faster response with combination therapy. Then, one thing you need to take note of is antidepressants are discouraged as monotherapy due to concerns of activating mania or hypomania. They are occasionally used to treat depressive episodes when patients concurrently take mood stabilizers. So now go to psychotherapy. There is supportive psychotherapy, family therapy, group therapy, and this may prolong remission once the acute manic episode has been controlled. Now, electroconvulsive therapy, it works well in treatment of manic episodes. Some patients require more treatment, up to 20, than for depression, especially effective for refractory or life-threatening acute mania or depression. So that's all on bipolar mood disorders. If you like the video, please like and subscribe. And the next video it will be uploaded will be on psychosis, specifically schizophrenia. Thank you.